Hi, my name's Dr. Miller. I'm the Director of Central Ohio Functional Medicine Health and Wellness Consulting. Today I'd like to talk to you very briefly about functional medicine. The word function means the ability to perform an intended or a useful action. In the body, there are multiple specialized functions that occur at a cellular level, at a tissue level, at an organ system level. Functional healthcare focuses on multiple factors contributing to decreased capacity, really, to maintain any type of homeostatic mechanisms associated with health. Um, Traditional healthcare, as the name implies, focuses and adheres to conventional approaches. Today, I'd like to compare and contrast the benefits of both the benefits of traditional and the benefits of functional medicine. Now, I'm we all know that traditional medicine is fantastic. It has great benefits. There will always be a need for it. It's great for handling acute trauma, heart attacks, wounds, fractures. Um, Traditional medicine has a particular paradigm, a particular model. It's mainly disease focused, and we'll always need that because disease is a reality. Functional medicine also focuses on disease, but really in a slightly different manner. We're really looking at some underlying causes that are very common for common to chronic disease. Traditional medicine, fairly symptom centric, and what I mean by that is that there's a cluster of symptoms that they'll look at and they'll focus on those. Again, functional healthcare focus on the underlying processes that are causing symptoms in reality. Um, Traditional care, pretty specialized, and that's because God made the body in a wonderfully complex and incredible way. And there's always going to be a need for specialty care: cardiologists, rheumatologists, orthopedic surgeons, neurological surgeons. Of course, all of that is needed. Functional health care is slightly broader in perspective, looking at these underlying cellular biochemistry, metabolic, genetic issues common to chronic health problems. What that means is essentially that underneath that basis, you say, wow, how can one discipline look at all these things when there's all these specialties? The fact is that under all chronic conditions, there are underlying causes associated with those. So we're looking at these fundamental basic causes. Um, Traditional medicine tends to be a little bit overloaded, overbooked. Functional health care, by necessity, we're going to limit the number of patients we see. We're going to manage fewer patients, and that's because we look in a more in-depth manner and out of necessity. Traditional medicine, fairly medication centered. Medications are needed. Functional health care is going to focus on lifestyle, on diet, nutrition. The medical paradigm, fairly rigid. Functional health care, it has a very large scientific base to it, researched, it's relevant, it's backed up in the medical literature, and we have evidence-based paradigms for treatment. Um, traditional medicine just does not have the time nor the inclination really to focus or have the wider perspective and to focus on underlying causes. Functional medicine has both the inclination, and we take the necessary time to investigate causative processes and factors. Traditional medicine, medical curricular standards, they've really not changed for a long time. They're not incorporating some of the newer concepts, some of the newer lifestyle and dietary issues related to health. Functional medicine, pretty dynamic, pretty expanding. The curricular content in regards to disease causation and prevention is very dynamic. So, I guess if I had to summarize it, I would say this. Regular traditional medicine asks a few questions. The questions are: what disease, what medications, what procedures can be done to control symptoms? Functional health care, quite a bit different. What cellular processes are causative for the patient's symptoms? What diet, what genetic, nutritional factors are involved? and how can we modulate those to correct those symptoms. So to summarize, functional medicine has a different paradigm than traditional medicine. Both have great strengths. I encourage everyone to have a family doctor, everyone to have a specialist if they need a specialist. But functional healthcare provides great benefit for patients as well, because again, we're seeking to answer the questions: why these symptoms, why the disease? It's a newer healthcare model, as I mentioned. It's systems oriented, scientifically based, looks at causes of medical symptoms and issues. Functional medicine physicians, we think in terms of contextual issues, multiple factors affecting your symptoms and disease expression. Functional medicine, we're going to spend more time with you as a patient. We're going to listen carefully. We're going to look for the interactions among biochemical issues, metabolic processes, genetic issues. We're going to look at the physiology. We're going to look at environmental and lifestyle factors that influence long-term health and complex chronic disease. The procedure all starts with diagnosis. I think for every physician, we start with diagnosis. You have to find out what are the problems, and more often than not, there are more than one cause for a health condition. So the first thing we do is really do a detailed case history, and that's your statement as to your chief concern, and we review that. We correlate all aspects of that health history, looking for family history, looking for the last time you've really felt well, trying to piece that all together. After that is done, and after we talk through that, we then do some comprehensive laboratory testing in a very prioritized manner. Now, I just do want to mention this on comprehensive laboratory testing. It's not the traditional medical testing. Nothing wrong with that. Great testing, disease-oriented. These tests are functional tests. They're done in a definite manner, in a definite order. We look at things like carbohydrate, protein, fatty acid metabolism. We look at gastrointestinal function to see how well you're absorbing and assimilating foods. We're looking at cellular energy production. We're looking at essential fatty acid analysis to see what the cell membrane is made up of, omega-3 and omega-6 trans fats, what goes in and what goes in the cell, what comes out of the cell. We're looking at organic acid analysis. This is a wonderful way to really look for vitamin insufficiency or depletions, because vitamins and minerals are cofactors for enzymes that drive pathways. We're looking at amino acid analysis, very important in a number of ways, but just to build up structural proteins and to repair tissues. We're looking at oxidative stress and free radicals. Everyone has heard about free radicals, and we're measuring your antioxidant status. We're also looking at elemental analysis for toxic elements, neurotransmitter tests, genetic tests, hormonal tests, and those are all functional oriented tests to help us identify the fundamental underlying causes and genetic factors associated and that are related to chronic disease. These tests are crucial because they help us develop first and foremost, they help us diagnose what's wrong. Secondarily, they help us develop a therapeutic strategy to correct or manage the dysfunctional problems. So, in summary, functional medicine is really patient-centric. It's in-depth focus on root causes. It provides great benefits for the patient, very low risk. It helps you regain your health, maintain your health, improve or optimize your health. I think that's a fairly good summary without going to great lengths. But I want to thank you for taking the time to listen. If you have a specific healthcare concern, questions, feel free to call me. I always do a brief consult relative to any health concern you have prior for you making any commitment for consultative care. You can take a look at my website, COFM, Central Ohio Functional Medicine, Health and Wellness Consulting, COFMHWC.com. For my email there is info, COFMHWC@gmail.com. I hope you'll take the time to look at some future videos on specific conditions treated with the functional medicine approach. see if those are helpful to you. Thank you so much for your time.